So tell me a little bit about yourself.
Yes, so I am Kabita Jackson. You can call me Kavita.
Okay.
I grew up in the Midwest. I'm a first generation Indian American.
Okay.
And I spent about the first 20 years of my life in Michigan.
Hmm.
Went to University of Michigan. That's where I met my husband. We've been together since we were 19. So
Oh, wow.
it's been a
Okay.
while.
Yeah.
And then I pursued medical school. So I left Michigan to come out to Philadelphia, where I
Okay.
was for the last 10 years for
Okay.
medical school and residency. And I just graduated last year.
Oh, okay.
And I specialize in emergency medicine. So I work at
Okay.
the emergency department. And I was just getting settled in with my new job over in the DC area. So we
Okay.
moved everybody, my whole family, husband and two
Okay.
kids.
Okay.
And then all of this craziness started just about December of last year.
Uh-huh.
Felt a little bit of pain.
Okay.
Kind of just grabbed myself out of pain and
Uh-huh.
felt, oh,
Right.
wait, what's that?
Right. Right.
That's not supposed to be there. So
Right.
um, I didn't have a doctor because we had just moved into the area. My
Okay.
insurance just started. So I said,
Mhm.
oh my goodness, let's find a
What am I
doctor.
gonna do? Right. Right.
Let's get started. And right about in March, when the pandemic started to take off, is when I
Hmm.
was diagnosed. So
Okay.
that's where my
So
life
you're
turned to where it is now.
right. So you're brand new here. You're not from here. Don't. Okay. I'm loving your hair.
Thank you so much.
Here we go, right?
Yeah,
So if you don't mind me asking,
sure.
you do emergency medicine at where are
Yes.
you located? Where do you work?
So I'm over in Maryland in a
Okay,
community
good.
hospital there.
Okay.
Yep.
Okay,
Uh,
so I finished trauma. I worked
okay.
in trauma burn
Yes.
for a facility, a hospital in the district.
Yeah. Okay.
Yeah, level 1 trauma center. And I was diagnosed in 2018,
Okay.
but didn't have any health insurance and didn't start any treatment until just about a year ago.
I see.
So if you don't mind me saying, you look
Sure.
very young. Um, you look extremely young. So did you have a family history? Would you mind telling me how old you are?
Of course. So I was 32. I'm now 33, through the
Uh-huh.
treatments and stuff. I had a birthday, but yes, I have no family history, not something that was ever on my radar. When I told my mom, who's a physician, she didn't believe me.
Right, right.
And I didn't tell her till after my diagnosis because
You
in my
probably
head,
didn't believe it yourself.
I
You
didn't
know,
believe it.
we go
I
through a
thought,
period of where, is this real? This can't be real. Am I really feeling something? What's going on?
absolutely. And I know the most common thing is it would be what we call fibrocystic changes within the breast or some sort of like a cyst, a fibroadenoma.
Mm-hmm.
Yeah, so I thought, let me just get my doctor. Let me not go through the motions exactly, but let's get the test done. I know what it is.
Mm-hmm.
It's not breast cancer.
Right.
I wouldn't get breast cancer.
And let me just interrupt you again briefly. So
Sure.
I love what I do. I can't imagine doing anything else that wasn't related to medicine.
Yeah.
But I also find that whenever we go to the doctor, I don't care what it's for, if it's just a pap smear, we tend to come out of our nursing and provider bodies and go into, you can't talk, you can't advocate. And then it goes from that to not being able to advocate for yourself to saying, oh, wait a minute, I know what's going on. I know what's wrong with me.
Right. Like, wait, I
Right.
know this stuff.
Right.
I'm
Right.
familiar with it, but I totally agree. When it's you, it just changes. I had to kind of push in some areas, learn how to advocate for myself the way, we advocate for the people that we take care of. And when things were explained to me throughout the process, I wasn't hiding it, but I didn't always introduce myself as doctor.
Right.
I would bring it up sometimes if they were, really breaking something down, and I said,
Right.
oh, hey,
Right.
I'm a doctor. You can speak a little medicine to me.
Right. Because it's crazy because I know when I go, I don't understand that layman stuff anymore. I need you to be honest with me. Just tell me, what is it? What stage? What grade? What's my onco
Exactly.
for? This.
Yep. But I did find sometimes if I say, hey, I'm a doctor, you know, it was like, oh, okay, well, you're a doctor, so you know. And I'm like, wait, let's backtrack. Let me just pretend I didn't say that. Pretend I'm not a doctor. You know, right now, this situation, I need you to break it down for me.
Absolutely.
You know, it just, when it's you, it's like all of your knowledge goes out the window. And I'm like, hang on, you know, really basic stuff that I deal with every day. I was like, no, just break it down. Pretend like I've never heard this before.
Right.
Yeah, it's tough.
So what, you're 33 now.
Yes.
No family history. Are you, tell me what your diagnosis was.
Yes, so
okay, I'm sorry, let's back up. So you went to the doctor.
Yeah.
And what happened?
So I said, of course, I was just establishing care. So I had a couple other things on my list.
Right.
I almost forgot about it till the end, you know, and I said, oh, wait, hang on. The reason I came in was this. And I was actually surprised. My primary care was like, all right, we're going to get a mammogram. We're going to ultrasound. We're going to do all these things. You need to go right away. And I was like, you know, oh, an ultrasound is fine. You know, do you think all of that's necessary? It's going to be a fibroadenoma, right?
Right.
And she was so thorough, very astute. She said, no, doctor, you need to go do this. And I said, no, you're right. You know, this is, if you say so, I'm not going to fight you. I'll go do it.
Okay.
I got the mammogram. I got the ultrasound. The radiologist read it in the center right away, which is awesome. Okay. And they said, hey, you know, we need to do a biopsy. And of course, is all of this necessary?
Or looking at your watch going, you know, I really got to I'm doing it midnight. I don't have time for this.
That's exactly what was happening. So I was working that night and they said, you know, we need to do this right away. And I said, you know, I work tonight. I really need to sleep before I get to work. So can I schedule it for next week? And they didn't really like that. But I said, you know, this got to fit into my life somehow. And I promise I'll come back. Absolutely. So I came back the next week. I got the biopsy the whole time, just like thinking, all right, go do all this stuff, get the test. They must be very conservative or something. And then I think I was heading into a shift a few days later and I got it was like, hey, you got some results. And I was like, all right, I'm just going to look at, I know what they are, but I'm going to look after my shift. So I'm not worried about this in the ER. I got home, I looked and I just about fell to the ground. I was like, what? Hang on a sec. Wait, what? You know, they clearly got me mixed up. So it was nighttime. I called them the next day to confirm, like, hey, I think you got my results mixed up with somebody. He said, oh, Dr. Jackson, we were reaching out to you. No, we're so sorry. And then.
So do we not call patients on the phone anymore with these types of results?
They do. I had missed a call while I was at work.
Okay.
And the voicemail just said, we wanted to discuss your results. And I had the results in my portal, you know, and I don't know if that happens usually or whatnot. And I understood
your insurance, because I know I'm a MedStar employee and I have MedStar health insurance and they tend to send everything to the portal. So, and, you know, being old school medicine, you know, we would call you to tell you your results were normal, you know. Okay.
Yeah. So I think they tried.
Okay.
You know, me being me, I was like, it's in the portal. I'm gonna go look. That's kind of how I prefer, you know, just do this. Let me see it. And then after that, there was a whole host of additional tests. We got to move. We got to get the port, the MRI. We got to start chemo right away. And this appointment and that appointment. You kind of, you know, I didn't really get to stop and think. I think that night I kind of like cried. I was confused. I don't even remember that point. It's like I kind of blanked out. I told work, like, I can't, you know, especially when I heard with the chemo and I got all these tests to do. I was like, you know, I can't make my shifts and I'm not okay here right now. Being responsible for other people. Like, it's not fair to my patients. And I need to now just step back and figure out what the heck this thing is that's going on with me. I have to do to, you know, get all right.
Okay. And so you had the biopsy. What was your diagnosis?
So it's invasive ductal carcinoma.
Okay. DCIS.
Yep. Mine is, so it's invasive, meaning DCIS means it's kind of contained a little bit.
Right, right.
Yep,
So
mine has now moved, is
Zemo.
making some moves,
Okay,
basically,
okay,
out of just within the local tissue.
okay.
So just like one step, I mean, there's a whole spectrum of
Yep,
disease here, as we know.
yep,
But it's
yep.
a slightly more, I guess, invasive. It had just left that local area.
Okay.
Um,
So
so
ductal carcinoma, what stage?
in the end of everything, I believe I fall into a stage 2 or 2B.
Okay.
Yeah, after, it required the surgery and additional testing, and I just got the staging information pretty recently.
Right.
Went through all of the genetics, and it was triple negative.
Okay, you are triple negative. Okay.
Yep. And went through
No family history whatsoever.
No, completely not on my mind in any sort, like, of all of the awful things that I could guess, maybe,
Right.
that this was totally not on my radar.
So you ductal carcinoma, stage 2, 2B in both
Yeah.
breasts or just one?
In just the right breast.
Okay.
Yep.
And what did you opt to do after? Did you have chemo and surgery, or just surgery, or?
Yeah, so the way it was presented to me, and I didn't question a lot. I felt very good with my team.
Okay.
I think, like, very trusting. I did a little research up front, but we had a real good connection. So I said, what your recommendations are is what I'm going to do.
Let me ask you, Dr. Kavita, sorry.
Sure, that's okay.
It's a habit, so.
That's okay.
Who was your surgeon, if you don't mind me asking?
Sure, Dr. Christine Teal at GW.
Okay. At GW, I know Dr. Teal.
Yes.
Yep.
She's awesome.
Beyond. What's next? So we have several doctors, but we have one medical doctor that's from Philly on our program, and then we have Dr. Regina Hampton, who's head of oncology over at Doctors Hospital. So, it's a small knit group, but it's a large group. And Dr. Teal is amazing.
Yes.
Absolutely. I mean, her bedside is amazing.
It is. It really is.
So
she wasn't very, she didn't tell me everything about herself in her personal life.
Right. Yeah.
As doctors, we
right.
leave it at the door, but my dad had found in the Washingtonian article and the Good Morning America interview and sent it to me. And the next time I saw her, I was like, hang on a second.
Why didn't you tell me?
Why did you tell me?
Right.
Like, we just connected even more because I understood where she's coming from. And I asked some more personal questions. I said, if you don't mind, about some Reconstruction questions, about her experience with the double mastectomy. And I knew it was then coming from somebody who experienced it herself, not just what we're reading in the books and what we see our patients go through. She knew firsthand. So, I trusted her even more. And her team was actually the same, her surgeons, the other surgeons involved were my surgeons.
Team was her team.
Exactly. They became my team. So
what type of treatment did you have?
So I had chemotherapy. I had 16 cycles. So that was about for 4 months, 2 different regimens. And then after that, I had what they called oncoplastic reduction, which was, removing the tumor, doing the lymph nodes. And I was in remission at that point. So that was in the end of July. All the pathology results came back negative. There was no spread to the lymph nodes or anything. The margins were clear. It was great. I did not stop there because my biggest concern was I'm 32. What are the chances this could come back? Yep. And they had told me very clearly it was about 1% a year chance of coming back, but that accumulates.
Right. As you get older.
Exactly. 5% in 5 years, that whole thing. And
then I'm always surprised how they say, well, okay, so I'm 51 and I was diagnosed when I was 48, but I had a strong family history. But I'm always shocked at how they determine your risk, because it seems so rudimentary. It seems like A and B equals C, and this is it. But it's not really. The science behind it is much more much more in depth than that.
Yeah, and it's not perfect. We're all making guesses here. It's not
Right.
like I can tell you 100% for sure.
Right.
So just so even hearing the estimates,
Mm-hmm.
it, to me, it turned into, okay, well, when is it coming back?
Right.
Basically,
Right.
it's going to be hanging over my head for the
Absolutely. You're gonna
rest of my
think
life.
about it. Right. Right. Right.
Any little thing, any sensation, any little something that feels different, I'm going to be right back there getting all tested again. And I can't live like that. Like, it's so
You don't want.
limiting, and
Right.
it's like it's taking control over me, and that's not all right. So I said I wanted to do the double mastectomy, like
Okay.
just get rid of it.
Okay.
It's not perfect. It brings my lifetime risk down to 3%,
Mm-hmm.
but 3% compared to the numbers,
Right. Right. You can
and
do 3%, you know.
yeah, if
You know what
that's
I mean? But the 1%, which give or take 2 or 3% as you
yeah,
get older, if you leave the breast tissue, that's, if you're not a gambler, that's, nobody want those odds aren't good.
no. And if 3%'s the best I can get with under my
Right.
control, I'm
Right.
doing everything I can to
Mm-hmm.
make sure we're never dealing with this, right? So I had that surgery 2 weeks ago today, actually.
Oh,
Yeah.
okay. Wow.
But
So are
I
you
feel
getting your
good.
pictures in? You look amazing.
Thank
I'm in
you.
my mind thinking, I'm like, okay, July. So I was a year in July. Okay, but wait a minute. It's just October. So maybe I missed the year. Maybe I got something wrong.
This is
Amazing. And you
it's
feel and look
recent.
great. You
I feel good. I can't say enough great things about Dr. Teal,
yeah,
Dr. Lannett, the whole
that whole team.
GW
Mhm.
breast. They took very good care of me.
Right.
And I'd like to think that's for all of their patients. I
Oh,
mean, I really feel it is, not just
I
me.
had several. Well, no news travels faster than bad news about a doctor. Nothing. So, and many of my friends that have had Dr. Teal do their procedure were, her team. You cannot, GW, that team is amazing, just like the teams at MedStar. But there are some little pockets in the area that don't have such good rapport with patients, the bedside manner, yada, yada, yada. So do you have your spacers in? Are you getting reconstruction?
So I did immediate reconstruction
Okay.
implants. It was an option, and
Right, good.
to reduce the number of surgeries. I was fortunate to have that option, I realize, and
Right.
that's a process in itself. When
Yes,
they mentioned
ma'am.
reconstruction, I was like, I didn't get that far.
But
I didn't think about that. I'm just
right,
thinking about
getting it out.
remove this, get it out.
Uh-huh.
And when they laid out all the options, I was like, hang on a second. I think Dr. Leonard was probably laughing at me. I was like, hey, can you start again? Let me write this stuff out. I was like, I don't remember half the things you said.
Right.
It took me a while to get it down and figure out what I wanted to do.
Okay, so I know that when I had my procedure, I had a double mastectomy. I had DCIS 1 and 2.
Both sides?
Both sides. But I had a family history. My grandmother's youngest daughter, and all 3 of my grandmother's sisters all had breast cancer. Myself, I had a 10-centimeter fibroadenoma removed when I was 9. So, I get it, but it just didn't fit into my schedule. You know what I mean? I was working 3 12-hour shifts, and then sometimes I would do 16. I'm a parent, my kids are grown. I have a dog. All I want, and the hospital was my life. Since 30 years, I've been in the medical community, and it's been my life. But when COVID kicked in, I saw things a little bit differently. And I lost 2 friends who were breast cancer. My breasties is what I call them. And they didn't die from breast cancer. They died from COVID. So at that time, I said, you know what? I need to take a break. I'm going to take a break and work on this nonprofit and go from there. But triple negative is scary, right?
Scary.
They're all scary. So my best friend, the CEO of Touch, she's triple negative. And I cannot wait for you to meet her. But when you're triple negative, normally you have BRCA or something, right? So you do not have the breast cancer gene.
I do not. It's,
Okay.
but it's very interesting. My oncologist has mentioned she's seeing this, you know, within the Indian community, at least me. Now, I wasn't aware this even happened to Indian women. Like,
Yeah.
sure, you know, anything's possible, right? I mean, that's my big lesson this year. But it's not something we talk about.
Right.
It's not something we really have ever heard of, any of that kind of stuff. But one, you know, my oncologist has mentioned she thinks from what she's seeing and the type of patients she's seeing, the women of color, and, you know, specifically some Indian women, that there may just be some genes that we have not found yet.
Right.
And once my parents started talking to more of their friends and family in India itself, they kind of came forward like, you know what, actually, it's been around.
Yep.
We know it's been around.
Right.
We're not
talk about it. You just don't
talk about it.
Right. And I know that a friend of ours, her name's Sonia, she has a website called Style Esteem, and she makes head wraps, you know, these little hats, and she's Indian. And she said the same thing. She said, you know, my parents talked to, you know, our family in India, and they were like, well, you know what, maybe such and such on the other side, or in another town in, you know, small town in India, maybe they had it, but it's there. But because of our culture, we don't talk about it. And even African-American women, we don't talk about stuff like that. You know, I can tell you that your husband slept with Tanya's cousin, but I can't tell you something as serious as I have breast cancer. You know, we can't, right. And that's the barrier that we're trying to get away from. Starting Sunday, we're starting to do a webinar called the Pink Table Talk, where we're traveling, mostly virtually, because a lot of people are still in treatment and this COVID thing has us so paranoid. We are doing virtual Pink Table Talks. Like Jada Pinkett Smith does the Red Table or something on Facebook. The only difference is that we're going into people's homes, doing these Zooms, speaking to mothers, granddaughters, grandfather, you know, the entire family, to talk about how do we bring breast cancer to the table? How do we bring it to the table, remove the stigmatism, whether it's in your son or your daughter, and get to a point where we can openly discuss things that are this serious. Because like I said, we can gossip about everybody in the neighborhood, but we can't come together and say, hey, look, we need to find out if our family has this BRCA gene, if our family has this FANCA mutation. But for whatever, we just can't do it. We're just not there yet.
Why is it? You know, I spoke to a couple both of color, and someone had mentioned, you know, she read something I posted and she said, you know, thank you for posting and sharing. I was diagnosed X many years ago, and I was so ashamed to tell anybody.
But why?
But why? You know, but what in our environment or our culture or society has given you that impression that you have to, you know, keep it down, deal with it yourself. We don't want to hear about it or know. Like, I mean, part of why I started my page is just to reach anybody and everybody, because if it helps one person,
that's all I need. That's
all I need. Whether it gives them strength or it helps them to understand a breast exam or just to be comfortable, you know, to help a family member, a friend, anybody. But that's all I needed.
That's all you need. But you know what, Kavita, you know what I think that if people spoke out more about their issue, I don't care what the issue is, depression.
Yeah.
No, I don't care what the issue is. If you speak out about that problem, that takes 50 pounds of weight off of your shoulders.
Yeah.
Period. I've always been very, very open, but never this open. Never. So, you know, never. So if you look through our page or my personal pages, you're going to say, oh my God, Terry doesn't have on a shirt. Oh my God, she's talking about this, because I found that that's what made me feel better. You know, that's what made me get over that horrible nausea. That's what made me come to terms with losing my hair. It brought me to a different level, and I was able to cope better. But my mother and even my aunt, who had a double mastectomy 3 years ago, Sunday, they're still not okay with talking about it. And I go to them, I said, come on, you guys want to do this pink table talk? Well, we don't really want to tell everybody. Why not?
Yeah.
Why not?
Yeah.
You know, but I wish we could make that go away, that stigmatism.
Yeah.
And, you know, we've been talking to several men that were diagnosed with breast cancer, and they don't want you to say they have breast cancer. They want you to say it's chest cancer. So then you have to take them to AP 1 and 2 class so they'll understand that anatomy and physiology said that's not your chest, that's your breast. And yes, you do have them. But we're talking to Matthew Knowles, Beyonce's dad, on Wednesday night. And since starting this organization, I never knew there were so many men with breast cancer.
I don't want to say I'm surprised, but I understand the stigmatism. I understand the reasons for feeling, you know, just from
absolutely.
We're all pink ribbon, pink this,
pink.
And breasts.
I'm sorry, your sound is going out a little bit. I think that's my computer. Okay, so yeah, you're right. Everything's pink. And there's even an organization called Real Men Wear Pink, you know, and we've got, breast cancer is so much more than a pink ribbon. Susan Coleman, that organization are our personal friends. We're doing something with them in November, but and even they acknowledge that it's more than pink, you know.
Limited. Sometimes I feel we get limited, or we're put in just the box with the pink ribbon.
Absolutely. We get in that box, and that's all we worry about is that box.
Yeah.
But when I said, when I was 48, before I was even diagnosed, when my aunt, who is my grandmother's youngest daughter, was diagnosed, she said, you know a lot of people at Hospital Center. You want to go with me and have this genetic testing? I said, sure, let's do it.
Yeah.
Fine, let's do it. I knew my history. I had a 10-centimeter mass removed from my left breast. I was 9 years old, nothing on the right, huge.
That's huge.
Like coconut on my left side. And from 9 years old up until probably 23, when I had my son, I always, who at 9 knows how to do a breast exam? And why at 9 are you required to do a breast exam? But I would do my breast exams, and then every time I went for a mammogram, it was never negative. In 50 years, I've never had a negative mammogram, ever. So it got to the point where I was probably 23 or 24. I had just delivered my son, and felt something in the right breast, I believe, and had it biopsied, and they're always negative, but the frequency was troublesome for me. As a young adult, I was like, you know what, I'm not doing this no more. They don't ever have to worry about me having another mammogram. I'm not doing it anymore. And then my pap smears start to be atypia and this is it. So I was like, okay, wait a minute. Then fast forward, I stopped going, and probably in 2013, I believe, I had a abnormal pap smear and had to have a hysterectomy. Still, they're doing the breast exams, Ms. Wade, you need it. Oh, I'm going to go have it done. I feel something. Okay, I'm going to go have it done. Never went to go have it done. Fast forward to 48, we go get this genetic testing, and then I feel something in both breasts. Okay. I was working for MedStar, the business portion of the hospital, where we would provide insurance for underprivileged people, people coming from different countries, that sort of thing. And I always women would come from Pakistan, Kenya, Nairobi with breast cancer. And I'm thinking, my God, yes, what is going on over there? What is it was worse than, to me, COVID, because COVID, they're going to find something and fix it. Breast cancer, for whatever reason, we can't find anything to fix it. So I said, okay, I'm going to go get this genetic testing. The genetic test showed BRCA1 and 2 in me, but not in my aunt. My grandmother passed away, so we don't know. And then her 3 sisters, 2 of them passed away, and the other one is like, I'm not doing that. If I have it, I don't want to know because I'm damn near 70. I get it.
Sure, right.
We lost our jobs. There was a layoff, and MedStar Family Choice closed its entire DC office. We no longer were able to provide insurance for DC Medicaid patients. And when I lost my insurance, I couldn't do anything. Nothing.
Just stops the whole
Stop. Everything stopped.
What are you supposed to do at that point?
What am I supposed to do? So I said, okay, well, I have my doctor, Dr. Boisvert at Washington Hospital Center, and my team there, my colleagues, were going to give me a prophylactic mastectomy, and I was fine with it. I didn't want no reconstruction because my breasts have never been a happy thought for me. Didn't want reconstruction, didn't want any of that, but I lost my health insurance. So I go to get Maryland Medicaid and had Kaiser. I thought Kaiser was trying to kill me, Kavita. I really felt like they weren't, I don't know if throughout your treatment, if you ever felt like you're just not listening to me. And I feel that they do that to us because we're medical professionals, and they think that half of us are hypochondriacs and the other half are crazy and the other half we don't know. Went back and forth with them, begged to be put on tamoxifen for prophylactically. Told them about their, oh, well, maybe, we don't feel anything. I'm like, are you kidding me? Like, I feel it. Long story short,
With your whole history.
My whole history. I qualified for a double mastectomy without having breast cancer, without feeling a lump, without any other clinical. So had that done, went and asked them to give me a double mastectomy. Oh, we can't do that. The state is not going to pay for you to have that. You don't have breast cancer. By the time it was all done, I was on tamoxifen for 6 months and had breast cancer the whole time. They didn't want to do a biopsy the entire time.
This is all related to the insurance, or what was the?
Because with state-funded insurances, they're limited to what they can do. And without a diagnosis, no provider was going to take my breasts without a confirmed breast cancer diagnosis. And I went to 3 different people, even went to the doctors I know that within Kaiser, because I had to stay within the Kaiser umbrella. And they would say, oh, well, if you do get breast cancer, it's going to be even harder to tell, or being even harder to find because your breasts are gone. So just leave your breasts, come back for your 6-month checks all the time, and you'll be fine. I went back to work with MedStar in January of last year. And that's when I found out that I had the breast cancer. Had to wait 3 months because, you have to wait for your private insurance to kick in. And in July, I had a double mastectomy. And the cancer was well on its, it was still in situ, but I have to do something else. Now I have to take another medication. Now I have to do this. And but it was the worst.
But how incredibly frustrating, because cancer in itself is devastating. It can literally ruin your life and your well-being. But knowing that there's something
going on, trying to get ahead of the problem.
And nobody's listening.
Nobody's listening.
So I had the double mastectomy in July, went back to work, and then they found I was really sick the whole time I had my J tubes in, and it was always felt like I had the flu. They found another mass in my left arm and in my thigh, and another one in my abdomen. So I had 3 surgeries.
Oh my goodness.
But I've never felt, just like you said, you look good, you feel amazing. I never felt as good as I feel right now. Like I can't, even when I was young, had no children, physically and mentally, I feel clear and blessed. But it was a long road because
very long road.
Nobody pays attention. Nobody pays attention. And having, what made me want to really, really talk to you was because you said, oh my, I don't know anybody here. I need, and that's what we do as sisters.
Yeah.
That's what we do as sisters. And if we could just get over the stigma of breast cancer and, like I said, we talk about everything else, but we cannot bring that to the table. And triple negative is very difficult because there's no medicine I can give you and say, here, take this. This is for only triple negative Indian Black women, or what, there's nothing on the shelf that says, take this for triple negative.
And I think in the beginning, so I think generally I'm a private person. And
right. As we all are.
Anymore, but I think, like you said, through this process, I've kind of grown
to share a little bit, and I see the value of sharing, and now I feel like, how can I not share that? I mean, just to connect with people. But in the
beginning, I just went into a black hole. I had my own denial,
and getting through life. I deal with it in my own head, and then I have my support system, family, husband, and I connect. But I just was in denial. It was a whole blur, and then I was stuck in the how could this. How?
What did I do
why?
wrong and save people? Why me?
What did I do? Just how? And then realizing, going through every detail, analyzing all the details, analyzing all the reports and the results, and finding out, it was triple negative. I don't have the BRCA gene. I was just like, I'm never going to get an answer, and I have to
get an answer, because that's our makeup.
It is.
Just in school, you figure this out until you get a diagnosis. You keep pushing until you get a diagnosis.
And at some point I knew, you're not going to get an answer. Like, I need to be okay with that so I can move
on. I'm still stuck in diagnosis, when my chemo and all that had started, I'm still stuck weeks ahead. And it just, then it was like, this is happening. This is real. You need to get with the plan, get on board, fight, support your body. That's okay.
Go through we have a dance party every day at 3 p.m. We're with Amgen, and Amgen is, they're promoting this, bones is the thing that they're promoting. So we're getting up and dancing and moving and everything. And something has been wrong with our Zoom links. So I'm trying to fix that. But if you could tell, you have daughters.
I do.
Okay. How are you going to approach this with them, or how did you?
And so at first I was going to tell nobody. And
that didn't work out. I kind of had to tell people and get support and to just manage certain aspects of my life.
Nobody, like your family?
Yeah.
Other than who lives in your home and maybe your mother and father.
Other than whoever it was inevitable that they were going to find out or notice.
And when I realized I couldn't hide it all, I shared. I got the support. I think it felt like you were saying, like just this weight was released, because now I don't want to say pass the burden on, but I'm sharing this with my support people. They're going to help carry me through this process. But so my daughters are 4 and 2. My 2-year-old is just, She has no idea. She's
Oh,
very like blissful. She's like a sweet, sweet, sweet. I kind of try to tell her she understands boo-boo a little bit, but
right.
she's living her best life. And that was one of the best energies I could have
Yeah,
around me, is just that such
absolutely.
an innocent, unencumbered
Mhm.
mind. My
Perfect,
4-year-old,
perfect little person.
yeah, like
Mhm.
just living her life,
And they
having a good
give
time.
so much love, and it's like,
Yes.
God, why can't they just stay that way? You
Why
know,
can't they
can't
stay
just
that
be this
way?
right, right. Why
Yeah.
do they have to worry about things like breast cancer and COVID,
Yeah.
wearing a mask, not being able to play with your friends, you know?
So I just let her do that. And I didn't hide anything physically. My 4-year-old
Is very like, she's like, where you been?
Yeah, what are
If
you
I
doing?
FaceTime her at chemo or something, she's like,
Right.
where are you, mommy? Show me. You at the
So,
hospital? Okay.
why are you at the
Go to
hospital?
doc. Yeah, why are you at the hospital? So she's seen my port. She's kind of touched it.
Uh,
Any Band-Aids I have, I let her look at them and take them off. When I had my surgeries, she's looked at my chest, in an appropriate manner. I let her look. I let her kind of touch.
Right.
Say that I have a
We have
boo-boo
a
here.
budding chief of surgery oncology at somewhere.
Yeah.
Absolutely.
Yeah, right.
We're grooming
She's
her.
interested, and she wants to look as interested as she was. I let her
Learn.
learn, and I tried to just break it down for her. I don't think I used the word cancer or anything, but essentially it's a
Right.
big boo boo. The doctors give me medicine through the port, all
Right.
that kind of stuff. And she's good. She tells the younger one, like, watch out, there's a big boo boo on mommy's chest, so stay back, be careful.
Aren't
Or
they
here,
amazing?
mommy.
They're
It's
amazing. They're so resilient.
That's exactly what they are. And
They're
it
so
like gives
resilient.
me strength just being around them. Like I said, they're just how they're living their life. Their
Right.
energy is just so positive. And, that's why I'm here partially,
Absolutely.
like this. Yeah.
So I know that I had a double mastectomy without reconstruction, and we're called flats in the breast cancer community. And I never knew there were so many women who went flat or chose flat as an option. And um, from a woman, from a female point of view who's still dating or what have you, I thought, I'm never going to, I've really ruined my poor little Jewish grandmother. I've ruined and broken her heart because I'm never going to get married now. And, in the Jewish community, removing your breast is taboo. So I said, I thought I took a huge leap of faith not having reconstruction, but I'm leading up to say, how do you feel as a woman with your losing your hair? How did that affect you, or did it?
It is very interesting. I have always had
Hair. Here, I'm a long-haired person.
Right.
Yeah. That
Yeah.
nice Indian long hair, real
Right.
thick.
That people buy for. Right.
I know people like my hair because I hear about it all the time.
Yes. Yes.
And it was something that I'm really proud of. Curl it up and, all that kind of stuff.
Right. And it was yours, and it was healthy.
Was mine.
Right.
Yes. So I thought that would be one of the hardest things for me. This is so funny. I'm going to show you. Ooh. I went out and got this amazing, it's hard to tell, but human hair.
Wow, that's beautiful. I need to borrow that, girl.
Well, I'll tell you why you can have it is I didn't wear this once.
I know, because that's not
like a single time. And my husband cut my hair off for me. I wouldn't let him do it until I had this. Cause I thought, no. Just in case I have to go somewhere, do something.
Suppose it's a bald spot. What am I going to do?
Yeah. I can't cut my hair until I get this.
And would you call
that on here so nicely?
It's beautiful. It's
collecting dust over the last 6 months.
Oh no, we got to fix that. I got to come get that. So you think it was more of an insecurity or a fear of the unknown?
I think both.
I would never ever, anybody who knows me, I never ever would have chose this. so it was very new to me, and I'm just terrified of, you know, and I thought, oh, my womanhood and my all this kind of stuff. I don't know why, but when it was gone, there was bigger fish to fry. This was, I was so not worried about it.
Mm-hmm. I had long blonde locks,
Oh my goodness.
like literally down to my waist.
Mm-hmm.
And throughout the years, I added locks and added this, but it was, for the most part here, it was my hair. And I was sitting in, my nephew has twins, a boy and a girl, and I was sitting in the floor playing with them. Now, mind you, I never did chemo. I've only been on tamoxifen. And I was twisting it, and it came out in my hand. And I thought I was going to die. I literally, you know, it was, and I'm like you, very private. I wasn't telling my family anything, nothing. I told my mother the day before. As a matter of fact, it was probably 8 hours before table time. I'm having a double mastectomy tomorrow. I have breast cancer, boom, boom, boom. Because I can't deal with all that. You know, I can't deal with thinking about my burn patient and whether or not you think I should have my breast removed. I can't do it. So for me, when my hair came out, it was just like, what the heck am I going to do now? What am I going to do? Right. So I cut it, but the tamoxifen, you know, it's just like an aspirin. You may be able to take it and have no problems, but for whatever reason, I had every problem that the FDA say could possibly happen. My hair was, so I was like, okay, I cut it a little bit, and then I started getting the bald spots. So I went and let my friend who's been cutting my boys' hair since they were toddlers shave it. And when I first came out shaved with my head, it was like liberating. I literally felt like I cut the cancer out of my body. You know, it was like an epiphany of sorts.
Well, it's like regaining control.
Absolutely. I felt like now I'm going to do this. I can beat this. Now let me start my advocacy. Right. I need to be able, I cannot focus on me being flat. I can't focus on my bald head. I can't focus on why people are looking at me, staring at me, wondering why I don't have any hair. And you know, what am I going to do? But I had to get to a point where it was, you know, I was okay. You know, I couldn't worry about what other people thought. When I went back to work, I went back bald, right? But I had on a wig. So, you know, we have MedStar, which is our trauma department, and then we have the regular ED. I was running to a code one day, to a code yellow, I think it's called, a code yellow it was. And I was so hot because tamoxifen literally, you know, I was sweating profusely. I took the wig off, and the chief of residence said, "Didn't you have some hair this morning?" And after that, it made everything okay. Made everything okay. So, you know, I think we worry about things as women that men don't have to worry about, but we worry about them, and it's these kinds of forums and this kind of sisterhood that helps us say, you know what, you're fine, you're still beautiful, you know, you're going to make it, but most importantly, you're going to fight and beat this cancer. Your hair is the least of your worries.
It's such a temporary thing, you know.
I remember when the patches started.
Uh-huh.
I freaked out as well, because one thing I feel like I associated with having cancer
and hair loss, like
there's a look that we have in mind. When the hair starts to go, it can make you appear like it's just
sick. It makes you look sick.
I'm sick now.
Right. It's officially taken over my body.
Yes, it's so
in your face, you can't ignore it, you know. And your eyebrows, my nails had issues, and you know, I was like, okay, I am officially sick. And,
And I agree. I think that that's like the catalyst. That's what says, like, oh, we're not in Kansas anymore. We're officially in cancer land.
Yep.
So so you were starting to say that you were in remission.
Yes.
Is that still the case?
That is still the case.
Awesome.
So I got the double mastectomy. I'm gonna recover up until
My recovery time goes until mid-November.
Okay. Okay.
I'm headed back.
Good.
My new normal.
Like,
Yes, right. And along with the masks that you keep in your pocket.
Yes.
Oh wow, that's amazing. Your story is amazing, but I just can't get over the fact that you were so young. We have a young lady on in our group, and I'm gonna start. You're now part of our family, so I'm going to be sending you emails, invites, and things like that. That Shantae is 35, 36. She's triple negative metastasis. It's metastasized. I want to say to her bone, to her spine, but she's like you, young, and she's an RN. She's an RN.
Something, a part of, I think, the message that you're spreading, I think it's very important that breast cancer does not discriminate. So
man or woman, no matter what color you are, no matter what age you are, family history or not. And it's not to make people fearful, it's to make people aware and know what to look out for, what's normal and not normal, and to help people advocate for themselves.
Right. And that's what's so important. And Shantae always says, well, I was advocating. I'm a nurse. You were advocating. You're a doctor. I was advocating. But
we know how to.
Right. But even still, we were ignored. And it's like you're damned if you do and you're damned if you don't. And that needs to stop as well. I know that I have a niece, and I think Tyria, she's probably around your age, 32, 33, something like that. And she went, because I want to have a mammogram. I feel something. I don't know if she said she felt something or not, but she wasn't aware that 35 and if you have a family history of breast cancer, you don't have to wait till you're 40 to have a mammogram.
Oh, no, you get straight.
And she didn't. I said the laws have changed as of this year. Yeah. And last year every year they've been making changes to that law. I said, so you are able to have a mammogram. Yeah. But we had a show Sunday, because now we do our shows on Sunday from 3 to 4 and then Wednesday from 6 to 7. And Sunday's show was about resources and advocating, and how there's so many people, doctors I don't want to say that they deliberately don't tell you, but for whatever reason, it's like with anything else, if you don't ask, I'm not going to mention it, because that means there's something else I have to do. So she wasn't able to get the mammogram when she thought, but she went today and got it and said, look, this is the law now. You have to give me this mammogram. And then the doctor was, oh, okay. It wasn't that I didn't want to give it to you. It was just, I had to make sure, whatever the case may be, we need to stop shooting ourselves down and knowing what your resources are and knowing what you can do will also help, empower us.
Absolutely. I think I would say, after the diagnosis, which, whatever, but going forward from there, I'm fortunate. I feel that everything has gone
right for me, with the getting in contact with who I needed to, the
coverage, a good team, all my treatments, and obviously being I am what should happen. Right.
You're how it's supposed to go. And you know that you don't want to think it was because you're a doctor. And I don't think it was that. I think it was the way that you advocated for yourself.
And I think part of that is, I do think
a little bit, because I'm a physician. I'm not saying I got preferential treatment. That's not what it is. But knowing the know-how, knowing how to advocate, knowing how to push and make sure, the things that I think should be done or in a certain way that they are done. What scares me is knowing that I'm not the average person.
Mhm.
I'm not better than anybody, but in this particular situation, I know how to do those things because I do them every day. I have the medical know-how. I know the, the warning signs and all that. I know
Right.
when I should be seen by a certain type of doctor. I have the health insurance. I have the access. So it really terrifies me when people, such as yourself, when you didn't have insurance for a while, or whatever the transportation to your treatments, or the, whatever the situation is, how in the heck are those people supposed to navigate this system?
You know,
You
they have nurse
it's
navigators,
just
but
not fair.
it's, those aren't perfect,
And if you tell me no, I don't
Stop
stop.
there.
Right.
But if a doctor or health system is telling somebody else no, what they're probably going to stop, because what
Right.
choices do they
Because,
have?
oh, well, the doctor said I didn't need it.
And you trust your
And,
doctor,
and you
right? So
trust your doctor,
and
right?
if they say
He wouldn't
no and
tell
they
you,
don't order
he
the
wouldn't,
test, it's
right. He
kind of
wouldn't tell
done.
you anything wrong. But I really believe that, and I'm sure your mother, everybody's mothers and grandmothers told them that first, that voice in your head, listen to it,
Listen to
because that voice knows what's going on.
Yeah. And
You
even,
know?
Even if you can't articulate it, you like feel something,
Yep.
and you
Something,
gotta dig, you gotta dig, you gotta dig, you gotta push your team to dig. And yeah, I think about that all the time. Even the complexities of medical insurance that I'm dealing with my insurance company.
Mm-hmm.
How does, someone with an average, let's say, reading level, or
less than average.
less
How do
than
they
average
navigate?
reading level,
Like
how
with
do how do
clinical
you
trials,
navigate that?
right? Clinical trials is a prime example. I have a friend who, her team is at Yale, and Allie is probably the single smartest person I know. But when it came time for her to fill out the paperwork to get in a trial,
oh, so much paperwork.
it was like she has my friend Ricky, who's the CEO of Touch, she has a degree from Kellogg and Dartmouth, and the two of them together was like, shucks, this paperwork. So what about the little lady over in Southeast Washington DC?
Absolutely.
How do you expect her to benefit from a trial that she can't even decipher the paperwork to get into?
Absolutely. And same with, I didn't do any clinical trials.
But just paperwork involved from the hospital or the
Right.
Questions. I would just show my mom, we talk about it a lot.
she happens to be a physician,
Mhm.
and to be like, we're struggling with this, understanding it or answering the questions, or how does somebody that's not as, that doesn't have the education level that we do,
Mhm.
how are they doing it?
Right.
Or
Right.
God forbid, not having insurance in this situation where you're like pushing, and everybody's no, no, no.
Mhm.
Then what do you do?
Right. What do you say? What do you say?
I don't even have the answers. It just came into my mind, and it made me so frustrated.
Right.
And I'm frustrated.
Right. Right. And so we have we partner with an organization called Citizen, and it's Citizen with 2 I's, that we have a campaign called Black Data Matters. And that's to kind of help people, women or men, who have breast cancer get into different trials and things of that nature. And it keeps all of their medical records into in a database. So if I go see my oncologist today, guess what? I have all my, and that's another hard thing.
Help for the person that you're talking, the provider that
Absolutely, absolutely, absolutely.
information.
So what do you think was your takeaway from, first, are you finished treatment?
Yes. Yep.
Oh, good. Okay.
Recovery, and I'm
Okay.
in
What
remission.
is your takeaway? What was the single most lesson that you learned?
So it sounds kind of broad, but it's applied in so many ways that
Anything is possible
Right.
in the world. And
for me. I take that with anything good is possible, anything bad is possible. You know, I have
Everything is
fought
possible.
yes, anything is possible.
Mhm.
Not to be fearful of it, you know, this awful thing happened, but
Right.
you know, I fought, I survived. That was possible, even when I didn't think so. You know, in the beginning, I would say, preface this, you can't post this part, but I thought I was gonna die. And
Yeah.
you know, you hear cancer, you don't hear anything after that. And I thought, all right, I'm preparing
Right.
to die.
Right.
That,
And then you think about how, you face death every day.
Yeah,
You know,
thing,
that's
right.
not right. You face it every day. You know
I
what
get so
your odds are.
desensitized to it, which is an
Right.
awful thing, but
It's not a good thing. You're right. But it's also, it makes us hard, and it makes us, it takes us to a point where if something happens to us, you immediately think the worst, and not that it's, I mean, I could have died from DCIS, it's not uncommon, but being in the medical profession is a blessing and a curse,
and a curse,
because
absolutely.
you immediately think that the worst, period. You immediately,
On
I
a day
have,
to day in the ER,
yeah,
that is my job.
right,
Doctor, worst case scenario,
right, right.
stop them. That's, you know,
that's what I do. That's how I think
It's your job,
naturally.
right?
That's,
You're
yeah.
trained to think that way.
yeah.
Um, but I know I would go in and I would see these burn patients who um um had burns over 20% TVA, and it was like, you could really die from this. If you get sick or get a cold, you could really die from this. And I've always been a shoot from the hip kind of person with my patients. But then when it came to me, I didn't always use that logic, you know. I always was, it was just like, well, if I die today or tomorrow, whatever. If I catch a cold and die, I just catch a cold and die. It wasn't, oh, I'm going to wear a jacket, I'm going to put on a hat. I immediately assumed that if the worst comes, it just comes.
It's like, it is what it is.
It is what it is. It
Yeah.
is what it is. But it was just, I don't know. I think this whole breast cancer thing, cancer period, but most importantly, breast cancer is scary. I can't imagine being triple negative knowing there's no medication that can fix you. But I can appreciate having breast cancer and thinking, if this comes back, what am I going to do? The worry doesn't change, whether you're triple negative, DCIS, or the worry does not change, and
No,
that was the
now
hard
that
thing.
it's happened once,
Yeah.
anything is possible. I just don't know. I agree. The worry,
It's just always there.
this is crazy. So July 2nd was my last chemo.
I had my surgery at the end. I went into remission. The week before my mastectomy, I was in the shower and I felt this little twinge of pain, same breast, same spot. I started feeling a little and I was like, oh,
Here's another one.
here's another one. So I called my surgeon, Dr. Teal, right? I was like, I know this is crazy. I highly, I know I'm being crazy and sensitive here, that there's no way this cancer could have come back in a couple weeks, but I feel this thing, and I was like, oh, she's probably just going to say, don't worry about it. We're doing your surgery next week.
Right.
No, she said, come right in.
A week, Kavita, one more week.
Yeah, right. She said, no, come in tomorrow. She did the exam. She said, I see what you're talking about. She did an ultrasound. I see what you're talking about. I think it's some scar tissue, whatnot. The plan still stands. But just for her to say, I hear you. I believe you. I'm going to investigate. Yes. She never made me feel crazy. I'm sure she probably thought, yeah,
right,
highly unlikely.
Right. You can think it all you want. You know what I mean?
Yeah. She took the steps and she gave me that reassurance, and the plan went on, and she was right. They did the pathology of the breast and everything was fine, but she listened. She she advocated for me, made an appointment that probably wasn't necessary in the end of it, but you know,
but it was
I felt better.
and making her patient,
Yes.
you know, as giving you as best peace of mind that she could in this
Yes, she
situation.
could. Yes. I mean, that's huge. And you need, that's what your team members should be like.
Right.
Taking care of you.
Have you ever thought about how are you going to, when you go back to work, how do you think it's going to be like that first week? People, because one thing that really, really got on my nerves was people asking me and looking at me like this. And you know how they look at you when you have big breasts, they look at you the same way when you don't have any. So
I am so incredibly anxious about going back to work.
Yeah.
So many reasons, the professional aspects of this whole pandemic that I need to get caught up on and jump right into, and that as well. When I was first diagnosed, I had wrote an email to my colleagues to let them know, and the email closed with, "Do not approach me or discuss this with
when
me
I come back, because it's done."
Or just in general. I think I had one more shift before I took leave, and I said, if you see me, don't talk to me about it.
Right.
This is what I was trying to hide, and I had to tell them because I was leaving work. So I feel much more open to address some of those concerns or questions. I think it's going to be something brief like, you know, I'm here. I fought. I am a survivor now. I'm in remission, and I'm feeling good because that's the truth. I feel good. I'm ready to move on. You know, I'm not ignoring this. This is always going to be a part of my life, and I want to help advocate for others. But right now, I'm feeling good, and that's what I want to talk about.
And that's what you want to talk about. That's
how I feel about talking about this right now, because that's how I feel.
Now, are you familiar with the Triple Negative Foundation?
I don't think so.
Okay.
I'm learning a lot here about all the different foundations.
My friend Ricky and my friend Haley are on the board of directors for the Triple Negative Foundation. Visit their website. Their website, and I'm going to throw your name out there to them, especially. Well, Ricky's going to know you anyway because you're going to come to the beach, and we're gonna
love the beach.
Right. Yeah. So I work on the beach. She has a condo, and
that's awesome.
That's what I do every day. Thank God it's not trauma. I don't have to worry about a code yellow or a code blue or a code nothing. And it's really helped me heal. But I want you to, the Triple Negative Foundation, visit their website, and we do a lot of things with them because Ricky is on the board and because so many women now are coming back triple negative. How do you feel about now? How does your family feel now?
I think they're really happy. There was a lot of
prayer all throughout India, and I have a huge family, and everyone got on board. I think they are just also grateful that things have gone the way it's gone. There's a huge increase in awareness just in my family now. Everybody that my family talks to.
And I'm sure in India, you made a change there, not knowing that you made a change.
I hope so. You know, my dad, I had started blogging
and thought, you know, let me share some of these pictures. And I didn't really show my dad because I know once he saw it, I showed him after it was publicly, after I had posted things.
Right.
Why would you do that? What are people going to say? Why would you? That's so personal.
And I got when I took a picture at the beach last month, you know, it was just like, shit, I'm tired. You know, I'm tired of hiding. I'm tired of, you know, I told you about it. Now you know, there's nobody on the beach. It's a private beach. There's nobody here but me. But yeah, we did post it. There's an organization called Not Putting on a Shirt, and I posed for them, and a French magazine who's promoting flat awareness and breast cancer awareness in France. I posed for them, but it was all about awareness, as your blog was. It wasn't about being embarrassed. It was about, how can I help this person get over this?
How can I help? And so my response was similar to what we said earlier. You know, if it helps
one person even think differently or feel differently or do anything, it's worth it. And what are they going to say? One, I don't care, but whatever they're saying, whatever they're talking about, it's going to include breast cancer. It's
Period.
going to be about breast cancer.
Right.
So
And I'm
whatever
going to
they're
make you
talking about
I'm going to
is
make
breast
you
cancer. Exactly. It's going to increase awareness. And
right.
I have lost nothing in this process of sharing. You know, I've only gained breasties and friends and sisters and so
Support
many
system,
people.
and not that you didn't have all of that in the beginning, but it's different.
It's
You know,
different. It's just different.
it's
Just
different.
different.
It's definitely different.
And through the pandemic, I didn't really seek, you know, I had so much family support. There was no, you know, the support groups weren't really meeting in person. Like all of that was done. I couldn't bring a support person to chemo and stuff like that. And that, I think it was okay because I kind of deal with these things, like I said, in my head a little bit. And
You're not going, right. You're not a support.
I was okay.
Right, right.
Yeah. But now you know, I wasn't against it in any way. I just thought, you know, this isn't really, I'm okay handling it the way I am right now.
Right.
And now that I'm getting towards the end of my treatments and stuff, and I've started reaching out on social media, I just did not know this whole community existed. And just connecting with a few people here and there. Now more and more people, I'm
Right.
like, oh, this is
right. This is real.
But now I'm ready. Like now I think I'm accepting of that. And so it's awesome.
Right. Right. That's amazing. I think that if we could share like this when we get the diagnosis, you know, I think that it would help a lot of awareness. My worry is about young women coming up who don't do their breast exams, because now the women are younger and younger, getting diagnosed younger and younger and younger. We have a young lady in Florida, and I want to say she's 19. How are you 19 with triple negative?
Yeah.
And instead of thinking about if you want to date Brian, you're thinking about who's going to take me to my chemo.
Yeah.
Who, you know, what am I going to do if I, you know, 19.
Stuff that you shouldn't have to think about.
And not that anybody, I don't care what age you are, you shouldn't have to think about, but 19. And I think about how I felt when I was 9 and not understanding that form of bullying where people were making fun of me because I had one breast, you know, and it wasn't even a breast. It was like a huge mass on the left side of my chest. So, you know, as mothers, we worry about those kinds of things, you know, like I'm sure you worry about your daughters every second of the day.
No, absolutely. I mean, that was one of my questions of like, okay.
Okay, we're dealing with, okay, fine. What about them? What am I supposed
to tell them? What am I supposed to do for them? When does their screening start? All that
Right.
kind of stuff.
Absolutely. Yes. When do they, right.
Really unclear right now. There's no solid answer. It was like,
you know, you just check in with the you know, let the pediatrician know.
Right. Right.
Adolescents and trying to figure out, just make sure you keep bringing it up because there's no
clear guidelines, I think, at this point for a 4-year-old and a 2-year-old.
Right. Oh, absolutely. Absolutely.
You know? So I'm like, okay, all right,
but it's that fear is over here.
Yeah.
Wow. And I think they are saying that most of the oncologists and breast surgeons and GYNs that are in our circles say that if you're 30, you were 32 when you were diagnosed. So I think there's some correlation about how you determine when your children will get tested or have their first mammogram. And even for me, I have a son. I have, you know, 28 years old and 2 others that I picked up along the way. And it's like, what do I, you know, how do I, good thing the other 2 aren't my blood, but my blood son, he just had a little girl, you know, and this thing is in our genes. And there's so many other, you know, you've had that genetic panel.
Yeah.
There's like 500 million things.
Yeah. How to translate that down.
Right.
Even the breast exams, I did not
do self breast exams. Like when I went through medical school, the recommendations from, there's about 3 main governing bodies. It didn't, you know, some of them say, I think the American Cancer Society says don't do a breast exam
until a certain age. Because you
Yeah,
don't know
like,
what you're feeling.
don't do it.
Yeah.
Or they say, you know, you don't have to, or this and that. And I said, okay, I know the recommendations. I don't do self-breast exams because that's not part of the recommendation.
And then
so when,
not only is it not part of it, but it's like, do you even know what you're feeling? You know, do I know what I'm feeling? 9 times out of 10, you don't. And you still may not know what you're feeling, you know?
But if you just do it, you stay consistent, you'll notice
changes, you know, you'll notice like, oh, this is what normal feels like. Okay, it's still feeling the same, okay, something's different. And that's like raising the alarms.
Right.
But when all my doctors, you know, I think they assume, they're like, oh, so you felt this on a self-breast exam. And I said, no, let me clarify. I didn't do self-breast exams because of the recommendations. I felt it. I just happened to have a pain. It was a complete accident. Mine was about 4 centimeter by 3 by 2 or something, sizable enough.
Right. Yeah.
I think if I had been doing them, I probably would have noticed it.
Right.
Early.
Right.
I mean, I was very lucky in the location. It was like the middle, kind of up here.
Oh, so up by your clavicle in the middle.
Like a little higher up.
Mm-hmm.
So it was more noticeable. I also have had large breasts my whole life, and I wonder if it was in a different location.
Right.
I didn't do self-breast exams.
Mm-hmm.
It could have gone on for much longer, and I would have had no idea until something else happened.
Right. And then they tell you, oh, it can't be cancer because cancer doesn't hurt. That's the biggest lie. I hate when I hear people say that. I'm like, really? It doesn't hurt, really?
It's not supposed to. Like I said, the things I learned in
med school, right?
Right. That's right.
This is supposed to do this. This is supposed to do that. And
this is what it says, right?
Now I'm a walking example of
what it doesn't
contradict that.
What it isn't, right?
What it isn't.
Or what it isn't, right?
Exactly. And it just makes me think really differently. And I think that's something I'll definitely take back to the ER. I'm probably going to be the person searching for all the zebra diagnoses and stuff. It's like, what do I believe now?
Right,
you know?
Right. What's going on? And then I'm sure moving forward, you're going to be an advocate for every woman coming through your ER, for sure.
I hope so. I know a couple of patients with breast cancer, you know, and I just think of them so differently now that, you know, things I had thought, not judgmental thoughts, but
just, but you
feel a certain way about certain
don't have blinders on anymore.
Yeah.
Well, it has been such a pleasure meeting you, Kavita. I mean, I can't. I was so disturbed because I was like, oh my God, what did I do? I thought I had it on time, and
you're fine. I couldn't get the password through. I was like, shit. And
right.
To me, and I lost it, and now I'm late.
Oh yes, so I'm just so glad to meet you, and please tune into our shows. I'm definitely going to be reaching out to you because I would love for you, when you're comfortable, to come on the show and tell your story. We're doing, visit our website. We're doing a lot of events in the next coming months, and definitely the Pink Table Talk on Sunday. Definitely watch that. That will be at the Triple Negative Foundation in New Jersey.
Okay,
Oh
awesome.
yeah, and visit their website. I'm sorry.
I said thank you so much for reaching out.
Yeah, no, thank you. How did you find us?
On Instagram.
I think I typed in breast cancer, and you know, I was going through some of the big pages. I would go through who they were following and who was following them.
Oh, okay, yeah, like that. Okay.
Anything related to like breast cancer that I could find. I was like, follow.
Right.
Trying to just get connected. Like this whole network, I had no idea existed, and I never used social media like this. I tell my husband that, you know, I was watching the Kardashians,
right,
you know, all that kind of stuff, and I got kind of bored with like my Instagram of like, okay, you know, how it's not really fulfilling me in any way, and now I found this whole new community and purpose and way to connect with people. So
right, absolutely. And you said you have a blog.
I do.
Tell us about your blog.
Yeah, so it's www.drladyblog.com.
Okay.
And that started, I think, right around when I had gotten diagnosed. Like, I don't consider myself a writer. I really don't enjoy doing it, but I was trying to think of outlets to ways to just express myself and get
Right.
some thoughts down,
Right.
actually for myself to remember
Right.
this experience.
Okay.
And then, you know, when family members were blowing up my phone with lots of love and stuff, like, what's going
Right.
on, what's going on, what's
But
going on?
blowing it up nonetheless.
Yeah, and I was like, okay, maybe if I just write these things down, I can
Right.
share it
Mhm.
once and people
Right.
can just read it so I don't have to repeat myself. It's traumatic every time you talk about
It
it,
is, and
especially in the beginning.
it dehisces the wound each time, for lack of a better term. It
Yeah.
opens up that wound every single time.
Yeah. So that's how it started, but people seem to enjoy it, and I definitely found it therapeutic, and it
Mhm.
just, you know, started to think of more things to talk about, and that led to the Instagram and like, hey, you know, let's share and
Right.
connect. And here we are.
So do you blog every day?
Not every single day. I will try to write some jot some notes down, like here and there,
Okay.
but not every day. There was actually, I think through chemo, maybe like a couple months gap at some
Mhm.
points that I thought, you know, at first I felt, oh, Kavita, you got to write something, you know,
Right,
people are
right.
expecting.
And
And
it's
then I was like,
therapeutic, like you said. It's
yeah, I was like, you know, if
Right.
you don't feel like it, why are you pushing yourself to do something you don't feel like?
Don't want to do. Right.
Yeah,
Right.
regardless of what you think other people's expectations may be. So I just didn't do it for a while.
Right. Right. Okay. Well, it was, again, I can't even tell you. I've been so excited about this for the last couple of days, and it was well worth it. I never talked this long, and I'm so happy I did, because that showed the connection between the two of us. And again, visit the website, sign up. We're having a Halloween virtual dog walk.
Oh my goodness.
So that's on Halloween, but like I said, we're on Sundays 3 to 4, and then every Wednesday from 6 to 7. And we're gonna do something. I want to do something big for Triple Negative Day, but don't know what I want to do. So I will be reaching out to you for that. October 15th, I think, or October 13th, one of those days. And I'll be reaching out, maybe doing a show and hoping to have you on as a guest if you're comfortable. All right. Well, thank you so much. I can't hear you. I'm sorry. We went out again. I don't know. Can you hear me? Perfect. Okay.
I was just saying thank you so much, and keep doing what you do.
Thank you so much, Dr. Jackson. Kavita Jackson.
Call me Kavita.
I'm sorry. Thank you, Kavita, and we'll be in touch soon.
Okay, thank you.
Talk to you later. Bye-bye.